Kia ora, good evening. The amount of time COVID cases have to spend in isolation is going back up. The latest move to strengthen our defences against Omicron. Anyone who tests positive for COVID-19 will now be required to spend 14 days in isolation. That's up from 10 days. Close contacts will isolate for 10 days instead of 7. And the case in Palmerston North could explain the shift. It's been confirmed as Omicron, but it's now thought they may have caught it overseas at least 2 weeks ago. There's also been a second suspected case of Omicron reported at Auckland Airport. In all, there were 23 new community cases of COVID-19 today, including 9 in Nelson, and all of those from the same household. But once Omicron takes hold, those case numbers are expected to explode, with new modelling predicting caseloads of 1,800 a day just in Auckland within 6 weeks of an outbreak. Here's our health correspondent, Lucy Warhurst.
A second worker at Auckland Airport has tested positive for COVID-19 this week, suspected to be Omicron. They're yet to find out how they got it, but a member of their household has also now tested positive. Meanwhile, isolation periods are being extended, 14 days for cases, 10 for contacts. Susie Wiles says it's a smart move.
What we know for all variants of the virus is that there is a kind of variation in the incubation period. And so, that still could be as much as, 10 to 14 days.
Meanwhile, hospitals are preparing for Omicron. Dr. Gary Jackson has carried out modelling on what's likely to happen if there's an outbreak in Auckland in the next couple of weeks.
If it does start in February, then I'm picking March and April. It'll peak and then drop off. And then we'll have a month to recover before we start thinking about winter. So that's my best scenario at the moment.
Based on what's happened in Australia, he says numbers could double every 4 days.
You'll see the numbers sort of rise from 50 a day to 100 a day to 200 a day.
Our Delta outbreak peaked at just over 200 daily cases. He expects Omicron to far exceed that.
We'll get, maybe 10 times that, or I'm suggesting 1,800 is my pick for where it'll peak.
So that's 1,800 cases per day just for Auckland?
Just for Auckland, yeah.
And while Omicron is milder, hospitalisations could double that of Delta, expected to peak at around 180 at any one time, and there will be deaths.
So you'll see the death rates go up a little bit in Australia. We'll have deaths here in New Zealand as well. And I'm particularly worried about the unvaccinated people.
He says it's difficult to predict exactly what Omicron will do. A lot depends on what we do. But the more people vaccinated and boosted, the better.
Oh, some sobering predictions there, Lucy. Is there any good news?
Yes, well, Mike, the numbers are expected to go up quickly, but they're also expected to come down quickly too. And New Zealand is expected to fare a lot better than other places. In London, in 1 week, 1 in 20 tested positive for COVID. But Dr. Jackson is expecting us to fare much better. He says with our traffic light system, currently in orange, plus our vaccination rates and the way Kiwis have already responded to the pandemic so far, he's a lot more optimistic for us. Now, once this outbreak begins, hospitals will have a couple of weeks warning before the surge in patient numbers, and they can put their plans in place. It will mean postponing some elective surgeries. We'll have more detail on that next week.
Lucy, thank you.